A very good morning, all of you. The penultimate day of our 21-day challenge. Welcome to day 20. So, I hope you guys are all ready. By the way, what's the answer to the question? How many dots do you find over there? Is it 7, 8, or 10? Yeah, 10 is right answer. Just carefully observe the entire sentence. You'll find 10. Okay, well done. We'll go ahead with our presentation now. So we're about to conclude our 21-day challenge. Today is day 20. So those who have been keeping up with these sessions, well done. I really appreciate your enthusiasm and just keep this momentum going. So in today's general topic, we'll focus on the following topic. Crisis situation, handling crisis situation, and how to turn or convert this crisis into an opportunity. A crisis is a situation which can either make you or break you, isn't it? These are challenging situations which have the potential to either make you or break you. If you react properly to the situation, a crisis can give you strength, power, wisdom you do not ordinarily possess. If you react improperly, a crisis can rob you of the skill, control, and ability that you ordinarily have to call upon. And if you carefully observe, the external situation remains the same, but depending on how we react to that situation, we'll have an output accordingly. In order to perform well in a crisis, we need to keep in mind the following things according to Maxwell Maltz. First, to learn certain skills under conditions which we will not be over motivated. That is, we need to practice without pressure because they go on giving us so many references, scientific experiments, wherein they stated clearly that if one is practicing under pressure, they are not bound to perform well on the day of the actual exam or the day where we need to actually perform that particular activity. So, performing or practicing without pressure is very much essential so that we'll learn those skills even more and in even much better way. So, learn certain skills under conditions where we'll not be over motivated. We need to practice without pressure. And number two, we need to learn to react to crisis with an aggressive rather than a defensive attitude, to respond to the challenge in the situation rather than to menace, to keep our positive goal in mind. So, by keeping this positive goal in mind, instead of panicking and getting carried away, we are in fact reacting aggressively. And number three, we need to learn to evaluate the so called crisis situations in their true perspective, that is, seeing things as they are, to not make a mountains out of molehills or react as if every small challenge were a matter of life and death. Some wonderful pieces of advice by Maxwell Maltz in his book Cybernetics. So every crisis, for that matter, every challenge is an opportunity. It has a potential to either make us or break us, and the output which comes as a consequence solely depends on our reaction to that particular crisis or external situation. So, with these initial comments, let's move on to our subject discussion where we'll today go through and celebrate the life history of Salk Jonas. So you might be very familiar with this name, Salk vaccine, Sabin vaccine, right? So what's this all about, and what's his contribution to the humanity as such? So Jonas Salk is an American physician. And before I start with this, as I mentioned previously in the previous session, the objective of this going through the biographies, the professional careers of celebrated scientists is to inspire all those who are going through this particular literature because science For that matter, service to humanity is not just about earning money. It's not just about doing things for ourselves. It is greater than that. It's for overall good. And also, in the process, we learn that there are no limits to human thinking or imagination. And anything and everything is possible if you are determined to do so. And that's what we're going to exactly learn from the life history, or in specific, the professional life history of Jonas Salk, who never gave up. And eventually, his discovery saved literally thousands and thousands of lives from the most dreaded disease of those times, that is polio. Even now, polio is prevalent in certain parts of the world, in some very poor countries where there is a myth or misconception regarding vaccination. But thanks to Jonas Salk and Sabin, who introduced these killed and live vaccines respectively, and helped us protect humanity from polio. So Jonas Salk was one of the United States' best-known microbiologists, chiefly celebrated for his discovery of his polio vaccine. Remember, it was a kill vaccine, and later Sabin he came up with a live vaccine, attenuated vaccine. So Salk's greatest contribution to immunology was the insight that a killed virus is capable of serving as an antigen, prompting the body's immune system to produce antibodies that will subsequently attack the invading microorganisms, viruses, etc. This realization enabled Salk to develop a polio vaccine composed of killed polio viruses, producing the necessary antibodies to help the body to ward off the disease without itself inducing polio. The eldest son of Orthodox Jewish Polish immigrants, Jonas Edward Salk, was born in East Harlem, New York, on October 28, 1914. His father, Daniel Salk, was a garment worker who designed lace collars and cuffs and enjoyed sketching in his spare time. He and his wife, Dora Press, encouraged their son's academic talents, just like your parents, sending him to a Townsend Harris High School for the gifted. There, young Salk was both highly motivated and highly achieving, graduating at age of 15 and enrolling in legal faculty of City College of New York. Ever curious, he attended some science courses and quickly decided to switch fields. Salk graduated with a bachelor's degree in science in 1933 at the age of 19 and went on to New York University School of Medicine. Initially, he scraped by on money his parents had borrowed for him. After the first year, however, scholarships and fellowships paid his way. In his senior year, Salk met the man with whom he would collaborate on some of the most important work of his career, that is Dr. Thomas Francis Jr. On June 7th, 1939, Salk was awarded his MD. The next day, he married Donna Lindsay, a psychology major who was employed as a social worker. The couple eventually had three sons. After graduation, Salk continued working with Francis and concurrently began a 2-year internship at Mount Sinai Hospital in New York. Upon completing his internship, Salk accepted a National Research Council fellowship and moved to the University of Michigan to join Dr. Francis, who had been heading up Michigan's Department of Epidemiology since the previous year. Working on behalf of US Army, the team strove to develop a flu vaccine. Their goal was a killed virus vaccine able to kill the live flu viruses in body, while simultaneously producing antibodies that could fight off future invaders of same type, thus producing immunity and a significant discovery. By 1943, Salk and Francis had developed a formalin-killed virus vaccine effective against both type A and type B influenza viruses and were in a position to begin clinical trials. In 1946, Salk was appointed assistant professor of epidemiology in Michigan. Around this time, he extended his research to cover not only viruses and the body's reaction to them, but also their epidemic effects in populations. The following year, he accepted an invitation to move to University of Pittsburgh School of Medicine's Virus Research Laboratory as an associate research professor of bacteriology. And when Salk arrived at Pittsburgh lab, what he encountered there was not encouraging. The laboratory had no experience with the kind of basic research he was accustomed to, and it took considerable effort on his part to bring the lab up to par. However, Salk was not shy about seeking financial support for the lab from outside benefactors, and soon his lab represented the cutting edge of viral research. In addition to building a respectable lab, Salk also devoted a considerable amount of his energies to writing scientific papers on a number of topics, including poliovirus. Some of these came to attention of Daniel Basil O'Connor, the director of National Foundation for Infantile Paralysis. This is very significant because this later on provided a lot of funding, in fact, exclusive funding to Salk's research. So O'Connor was the director of National Foundation for Infantile Paralysis, an organization that had long been involved with treatment and rehabilitation of polio victims. O'Connor eyed Salk as a possible recruit for polio vaccine research in his organization, which was sponsoring the research in these lines. And when two finally met, O'Connor was much taken by Salk. So much so, in fact, that he put almost all of the National Foundation's money behind Salk's vaccine research efforts. Just imagine someone trusting you to such an extent. Poliomyelitis, as you know, caused by virus. It's traceable back to ancient Egypt, causing permanent paralysis in those it strikes or chronic shortness of breath, often fatal, leading to death. Children, in particular, are especially vulnerable to poliovirus. The University of Pittsburgh was one of the four universities engaged in trying to sort and classify the more than 100 known varieties of poliovirus. However, by 1951, Salk was able to assert with certainty that all polioviruses fell into three broad types, each having various strains. Some of these were highly infectious, others barely so. Once he had established this, Salk was in a position to start his work on developing a vaccine after understanding the categories. Salk's first challenge was to obtain enough of the virus to be able to develop a vaccine in doses large enough to have an impact. This was particularly difficult since viruses, unlike culture grown bacteria, need living cells to grow. They depended on host cells. The breakthrough came when the team of Enders, Weller, and Robbins found that the poliovirus could be grown in embryonic tissue, a discovery that earned them a Nobel Prize in 1954. Salk subsequently grew samples of all three varieties of poliovirus in cultures of monkey kidney tissue, then killed the virus with formaldehyde. Salk believed that it was essential to use a killed poliovirus rather than a live virus in the vaccine, as a live virus vaccine would have a much higher chance of accidentally inducing polio in inoculated children. He therefore exposed the viruses to formaldehyde for 13 days. This is very interesting. Even though, according to his studies, 3 days is suffice, but he extended that to 13 days to be on safe side. Though after only 3 days he could detect no virulence in the sample, Salk wanted to establish a wide safety margin. After an additional 10 days of exposure to formaldehyde, he reasoned that there was only 1 in a trillion chance of there being a live virus particle in a single dose of his vaccine. Salk tested it on monkeys with positive results before proceeding to human clinical trials. Despite Salk's confidence, many of his colleagues were skeptical, believing that a kill virus vaccine could not possibly be effective. His dubious standing was further compounded by the fact that he was relatively new to polio vaccine research, and some of his chief competitors in the race to develop the vaccine, most notably Albert Sabin, the chief proponent of a live virus vaccine, had been at it for years. As a field narrowed, the division between the killed virus and live virus camps widened with their own opinions, and what had once been a polite difference of opinion became a serious ideological conflict. Salk and his chief backer, the National Foundation for Infantile Paralysis, O'Connor, were lonely in their corner. Salk failed to let his position in the scientific wilderness dissuade him, and he continued undeterred with his research. This is what is very important, and I think this is what is relevant to what we discussed prior. So during times of crisis, you know, you can either make something out of it or you can simply break and give it up. To test his vaccine strength, in early 1952, Salk administered a type 1 vaccine to children who had already been infected with polio virus. Afterwards, he measured their antibody levels. His results clearly indicated that the vaccine produced large amounts of antibodies. That means the body is responding, the immunity is responding. But by success, the clinical trial was then extended to include children who had never had polio. In May 1952, Salk initiated preparations for a massive field trial in which over 400,000 children would be vaccinated. They were called as vaccine pioneers, polio pioneers, the largest medical experiment that had ever been carried out in the United States. The test finally got underway in April 1954 under the direction of Dr. Francis, sponsored by National Foundation for Infantile Paralysis. More than 1 million children between the ages of 6 and 9 took part in the trial, each receiving a button that proclaimed them a polio pioneer. A third of the children were given doses of vaccine consisting of 3 injections, one for each type of poliovirus plus a booster shot. A control group of the same of children was given a placebo, and a third group was given nothing. At the beginning of 1953, while the trial was still at the early stage, Salk's encouraging results were made public in Journal of American Medical Association. Predictably, media and public interest were intense, anxious to avoid sensationalized versions of his work. Salk himself agreed to comment on the results thus far during a scheduled radio and press appearance. Despite the doomsayers, on April 12th, 1955, the vaccine was officially pronounced effective, potent, and safe in almost 90% of the cases. The meeting at which the announcement was made was attended by 500 of world's top scientists and doctors, 150 journalists, 16 television and movie crews. The success of the trial catapulted Salk to instant stardom, which he hated very much. Wishing to escape from the glare of the limelight, Salk turned down countless offers and tried to retreat into his laboratory. Unfortunately, a tragic mishap served to keep the attention of world's media focused on him. Just 2 weeks after the announcement of vaccine's discovery, 11 of children who had received it developed polio. More cases soon followed with kill vaccine. Altogether, about 200 children developed paralytic polio, 11 fatally. For a while, it appeared that the vaccination campaign would be railroaded. However, it was soon discovered that all of the rogue vaccines had originated from the same source, that is, Cutler Laboratories in California. So, on May 7th, the vaccination campaign was called to a halt by a Surgeon General of US. Following a thorough investigation, it was found that Qatar had used faulty batches of virus culture which were resistant to formaldehyde, causing this mishap. After furious debate and adoption of standards that would prevent such a reoccurrence, the inoculation resumed. And by the end of 1955, 7 million children had received their shots, and over the course of next 2 years, more than 200 million doses of Salk's polio vaccine were administered without a single instance of vaccine-induced paralysis, not even a single case. By summer of 1961, there had been a 96% reduction in number of cases of polio in United States compared to a 5-year period prior to vaccination campaign. After the initial inoculation period ended in 1958, Salk's killed virus vaccine was replaced by live virus vaccine developed by Sabin. The use of this new vaccine was advantageous because it could be administered orally. Also, required fewer booster inoculation. To this day, though Salk remains known as the man who defeated polio. In 1954, Salk took up a new position as professor of preventive medicine in Pittsburgh, and in 1957, he became professor of experimental medicine. The following year, he began his work on vaccine to immunize against all viral diseases of central nervous system. As part of his research, Salk performed studies of normal malignant cells, studies that had some bearing on problems encountered in cancer research. In 1960, he founded the Salk Institute of Biological Studies in California, heavily funded by National Foundation for Infantile Paralysis, which is known as March of Dimes. The institute attracted some of the brightest scientists in the world, all drawn by Salk's promise of full-time, uninterrupted biological research. Salk died on 23rd June 1995 at San Diego Area Hospital. His death at the age of 80 was caused by heart failure. The interesting thing in his entire professional career, which is in fact not given over here, which is available in other references and literature reviews, that Salk never patented his discovery. In fact, the kill vaccine was his discovery out of his research funded by National Foundation. But in spite of his discovery, he never patented his discovery and never made money out of it. And he rather encouraged that the vaccine formulation should be distributed as widely as possible, thus saving thousands and thousands of lives, especially children. And that's one of his greatest contributions to humanity, isn't it? So this is about the life history of Salk, his work career, and about his personal life in brief, and how his contribution has helped us overcome one of the dreadful diseases of mankind, that is polio. Unfortunately, even after a discovery of kill vaccine, live vaccine, polio vaccines, polio is still prevalent in certain parts of the country. I heard, as far as my knowledge is concerned, I heard it's still prevalent in some parts of Afghanistan and Pakistan, and not sure about other parts of the world, which is very unfortunate because we have a solution. And if we are not working on providing that solution to the population over there, it's obviously crime against humanity. So, anyways, this is what I wanted to highlight in this specific video. I hope you enjoyed the session. And today is day 20, and tomorrow will be our final day of our 21-day challenge. And we'll plan some additional events tomorrow before we wind up our amazing, wonderful, and I can use as many adjectives as possible. And it's been thoroughly a kind of experience which enhances each one's personal as well as professional life. So 5 a.m. Club, I hope you're all enjoying the same, and I'll see you again tomorrow on final day of our 21-day challenge, that is day 21. So wish you all a great day ahead. Love you all.